Hi, I'm Dr. Rajani. Thanks for joining me today. I'm talking PlasmaLIP. A lot of people have asked about PlasmaLIP. Sometimes you see me do it when I'm doing my PlasmaSculpt procedure and we address the lip at the same time. People come in for lip for one of two things. Number one is shape, to get more volume, to balance the face, to create an angle, to lift the edge of the mouth. Or number two, to rejuvenate it. Perioral rejuvenation, meaning there's lines around the lip, the skin is dull, it seems to be wrinkly or crinkly. You can see that there's lip lines in the lip itself are getting worse, and that really bothers a lot of people. And if you look from youth, as we age, we lose a little bit of color. And so some people want to get that color back. Let's talk today about PlasmaLIP in a Rajani's quick clip in 3 seconds. So PlasmaLIP is a procedure that rejuvenates the lip by using one's own body's products, or healing products, stem cells, mesenchymal stem cells, however you want to look at it. There's no filler, it's all natural. It does require a blood draw. Often we can use the plasma for other things as well. But for many people, especially female skin type 2, 3, lighter colored skin, especially if hormones have changed, the skin gets very thin. Because the mouth is dynamic, because we're moving, we have to eat usually, we're moving our mouth, people chew gum, people are always making faces and expressions. Thinning of the skin with movement, with bone loss, that leads to lines and folds. And you can't really stop talking, moving, eating to prevent the lines like people do for sleep lines. You can adjust how you sleep. It's pretty hard to change what's going on around the mouth. You can stop smoking, you can stop chewing gum, but perioral lines and rejuvenation is really key, especially for that lighter skin female when estrogen goes down and you lose bone. For angles and folds, fillers work very well, but a lot of people don't want an overdone looking lip, and that's where PlasmaLIP comes in. So platelet-rich fibrin, what is it? We spin the blood down. We don't add any heparin or sodium citrate, so there's no blood thinners, there's no calcium, there's no need. If you know how to produce PRF, you get 17 minutes of working time, which is more than enough. There are things coming down the pike that I'm excited about where we're extending that time, but for now, 17 minutes, and that's plenty to do what we need to do. Now, what's special about platelet-rich fibrin versus PRP is that because we don't have those additives, we get a clot formed. So when you cut yourself, you heal, the skin moves together, you get a scab on the outside. That scab is important. What would happen if you continually took that scab off? You wouldn't heal and you would scar. What happens when you cut yourself is the platelets go in there. It says, hey, coagulate and form that scar. What we're doing to heal that skin, to make brand new skin, think about the beauty of that. We can make new skin. It's a phenomena. We're actually mobilizing our stem cells, pluripotent stem cells that can cells in our body that can produce many different things. In this case, skin. We mobilize them. The clot that forms from injecting that platelet-rich fibrin slowly releases growth factors. Why is that different from PRP? PRP has the blood thinners, there's no clot formed, and you get an immediate release of a lot of mesenchymal stem cells, recruiters, growth factors, but it's for a short period of time. When you cut your skin, that scab isn't there for a short period of time. It might be a week or longer. Same thing when we do plasma eyes, there's going to be you see a little clot or a little fullness under the eyes for 4 to 6 days. In PlasmaLIP, it's very similar. Slow release of growth factors in the lip leads to what? Increased redness. The red lip is attractive, it's sexy. Why? It's because one of the thoughts is during the hormone cycle. When the estrogen's high, the lips look red. It's meant to be attractive during a fertile period. So it's very fascinating to study this stuff. But what we're doing with the slow release of growth factors is helping the fine lines in the lip, improving color. You can't create these fantastic projections or ski jumps in an older person. You need a little bit of filler if you want poomph, if you want a little pop, but you get rejuvenation. And for a lot of older people, or a lot of people that want a very natural look, a lot of people bring up Sharon Stone. I want to look like Sharon Stone. She's 63-ish or so, looks good, but natural in many ways, not always, but in many ways she's very natural, hasn't done a lot, and looks good. People want that look. They don't mind lines and folds, but they might not want the degree of vertical lip lines. Why not do something about it that looks natural? I can tell you, if done properly with a cannula, what we call undermining or breaking up some of the lines and folds, adding platelet-rich fibrin with those healing factors, we get phenomenal results. Young people do like it a lot, actually. You would think, well, they want the TikTok lip. Now, I almost call it the TikTok lip because that's what people want. They want a lot of bling. They might not want the ducky lip, but look at Bella Hadid with her upper lip bigger than the bottom lip. People like that. We have a video, I put a video up years ago, the 50-50 lip. People thought it was a little crazy at the time, but you see, that's what people want. You can have what you want. If you want a traditional 1.61 to 1, the bottom bigger than the top, great. If you want something different, you can create it. PlasmaLIP doesn't create a lot. It's more to rejuvenate. I think that's the differentiating factor. If you, after making the skin better, getting a little color, helping with lines, it will give you some volume. If you want a little more, you can add filler certainly around it, before it, after it, during, at the same time. But it really is a nice way to rejuvenate it without adding filler, or in between filler treatments. If you're getting fillers every year or two, yes, filler in the lip can last 2 years. In between, you can get a little PlasmaLIP to kind of perk it up a little bit. How I developed it, mainly doing my PlasmaSculpt procedure where we treat the whole face, I noticed a few things. One is people want more brow hair. People want the under eye addressed, and of course we never put sculptor under the eye. And people want the lip addressed, but they might not want a lot of filler, projection, or unnatural look. Thus I came up with the Plasma Brow, Plasma Eyes, and PlasmaLIP to suit that, because I was doing those by nature with my full face PlasmaSculpt procedure. So PlasmaLIP, go to plasmalip.com if you want to see more. It's just something I do for my patients. Every physician is going to have their own type of procedures and what they do for their patients. I like to do this for my patients. It works extremely well. They like it. They get great results. Tell me, what do you like? Do you just want the TikTok filler lip, or do you want a more natural look? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.